Hi, this is Brian Kim. I'm going to share with you case number 100 in the best way to do cataract surgery series. I decided to share this pretty dense cataract. This is a cataract, and I'll be implementing some of my techniques as well as some techniques I've seen on YouTube using terminal chop, which is a modified stop and chop technique, fracturing from the equatorial side, and then also implementing the mechanical fracturing techniques that I do. And this is, to me, this is the most efficient way to conquer the posterior plate. So I'm using a cotton tip to steady the eye and use a corneal marker, which will help me to center and size my rhexis. I make my paracentesis incision first on the right side and then the left side, making sure the incision is flat to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. We're going to inject some intracameral lidocaine and then some dispersive viscoelastic to coat the corneal endothelium and to fill the chamber. This is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel into the cornea, using the cannula to control the eye. I turn it towards me, and then I enter. I push some more viscoelastic at the end. Using the forceps, turn sideways or go in for the puncture style technique with the forceps. Puncture the center, pull downward towards me. You can see there's a little bit of zonular laxity as I try to pull. There was some wrinkling in the capsule. Again, not surprised in this dense lens. I do feel like dense lenses and zonulopathy go hand in hand. So I'm making the rhexis going around circumferentially, using the corneal mark to help me center and size the rhexis. Finish off the rhexis, burp some viscoelastic, and this is the Capsulorhexis hydrodissection technique. I place the cannula under the rhexis edge, contra-incisionally, point the tip down, get a nice wave, turn the tip back up, decompress on the left side, point the tip downward, and I'm able to spin the lens here. Irrigate the surface of the eye, adjusting the sleeve. And again, I normally don't sculpt, but I think in these dense lenses, it's quite helpful to debulk the endonucleus and then be able to separate it deep down into the entire length of the lens. So I'm removing the surface epinuclear material, switching to quadrant mode, turning the tip so that it's bevel up now. So then I'm going to start to sculpt. This is a pretty dense lens. And the hard part is sometimes the lenses are so dense that they don't want to sculpt. But thankfully in this case, I'm able to sculpt pretty well. And I'm not putting too much stress on the zonules. I'm very mindful that with this technique, you have to really push down on the lens. And I don't want to cause any zonular stress here. But thankfully it's cutting. And with this technique, you don't really have to go all the way down to the bottom, which is kind of nice. Because with terminal chop, you're able to fracture from the equatorial side, and it propagates from one side all the way towards you, so from the distal side all the way to the proximal side. So I'm pretty much done with my sculpting. I turned the bevel back down. I place a chopper under the rhexis edge. I'm going to, at the end of the trough there, on the equatorial side, I'm going to fracture, chop it, and then I'm going to try to spread and separate. And that chop should propagate all the way through. In this case, it went halfway. That's okay. I don't want to perseverate. Go ahead and do it on the other side, placing the chopper out to the equator again, and then separate. When you do this, you're going to see you're going to have a nice separation. Place the chopper around the right heminucleus, pulling it centrally toward the fingertip where it meets the fingertip. I'm able to fracture the right heminucleus in half. Placing the chopper around the first quadrant, pulling it centrally toward the fingertip. The fingertip acts like a cutting board where you're able to use it as an opposing force when you crush the lens. Lifting that first piece with some vacuum, crushing it between the instruments, and then emulsifying the lens pieces. grabbing that piece up with some vacuum, crushing it with the instruments, and then emulsifying the lens pieces. I'm going to turn that second quadrant in front of me, placing the chopper around the lens piece, crushing the lens in half, separating the pieces, grabbing it with some vacuum, crushing it again, making sure it's separated completely from the other pieces, and then emulsifying that fragment there. So again, this is a pretty dense lens with some dense leathery adhesions. And so by breaking the lens in half completely with that modified stop and chop, the terminal chop technique, it's really advantageous, and you'll be able to take the pieces out much more easily without having to deal with that leathery posterior plate. So I turn that second heminucleus in front of me, placing the chopper around the lens piece, bring it towards the phaco tip, crushing it against the phaco tip, and then I'm spreading as I go here. I'm just spreading some more, making sure the pieces are separated. Placing the chopper around that third quadrant, pulling it centrally towards the phaco tip, crushing it and dividing that lens piece, grabbing that fragment up with some vacuum, getting around it with the chopper, and then crushing it, just breaking it down into smaller pieces, and then emulsifying the lens piece. And that's really the key, breaking up the lens into smaller and smaller pieces using mechanical forces, and then using the phaco in order to emulsify and remove the lens piece when the pieces are smaller. That's the trick. By doing it that way, you're able to reduce the ultrasonic energy. So I turned that last piece in front of me. It kind of tilted on me, so I'm able to bisect that lens piece in half, grabbing that fragment with some vacuum, and then crushing the lens pieces into smaller pieces, and then emulsifying the lens piece. You can see here the CDE is into double digits, but most of that is due to the fact that I had to sculpt in the very beginning. So positioning the lens so that the two instruments are on each side of it, and then crushing the lens piece, using a little bit of vacuum to control the lens piece here. These lens pieces are so dense, when you're trying to fracture it, you can feel the density of the lens as you're trying to break it. So this is the final fragment. You can see the bag is completely empty. So I just kept the phaco tip deep and emulsified it. So take the chopper out, push BSS in, take the phaco tip out. And here I'm getting quite a bit of fluid egress. I had the incision, I suppose, a little bit close to the conjunctiva there. And so I was getting some ballooning. So you just go ahead and do a cut down, and that'll fix the problem. So go in with the INA handpiece, start sub-incisionally, removing the cortex. Switch to polish mode, removing under the rhexis edge, looking for any more cortical material as well. Polishing the posterior capsule, you can see the capsule contracting into the tip, which just confirms a zonular laxity. Pushing BSS into the subincisional space. injecting cohesive viscoelastic into the bag, and then I go ahead and sweep under the rhexis edge here. I'm going to widen the incision again. This is a 3-piece lens. I like to use a 3-piece lens in these dense lenses because of the zonular laxity in these cases. Turn the bevel to the left, deliver the leading haptic into the bag, which is nice and planar. As the optic opens up, rotate my hand 90 degrees counterclockwise, and then use a Maltzman to dial the trailing haptic into the bag. And go in with irrigation off, activate irrigation, go under the optic, remove the viscoelastic from within the bag, remove all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a very dense lens. There's a variety of ways to disassemble the cataract. Unfortunately, you can get a posterior plate in these cases. I think sculpting in the traditional sense is not really efficient because then you're trying to crack from the middle. That's very inefficient because of the forces and the angle in what you're trying to do. With terminal chop, you're actually chopping from the equatorial side distally, and you're able to propagate that fracture all along the lens. And if you don't get it all the way through, you can rotate it 180 degrees and do the same thing on the other side. So by doing it this way, you will basically eliminate any chance of having a posterior plate. And then after that, you can utilize mechanical fracturing techniques, which again helps you break down the lens into smaller pieces before you emulsify them. And this reduces ultrasonic energy, and this allows you to have nice clearer corneas at the end of surgery. It's a very safe, methodical way to disassemble the lens, especially for the extremely dense cataract and conquering the posterior plate. So I hope this was helpful to you, and I thank you for your attention.